My name is Megan Murphy. I'm a clinical psychologist at PCA and WA, and some of my specialties here are anxiety, depression, post-traumatic stress disorder, chronic pain conditions. I love working with grief and postpartum issues. I have some specialty training in a few different types of therapy. A lot of my kind of therapeutic foundation is cognitive behavioral therapy, which is very described as like an active approach, an engaged approach where teaching you to become your own therapist, giving you the tools to address your thoughts and your behaviors and how they might impact your emotions. And have specialty training in CBT-based interventions related to trauma, related to OCD, generalized anxiety, depression, behavior change, smoking cessation, alcohol use and dependence, things like that. So we moved to Northwest Arkansas probably, 3 years ago. And I was born and raised in Arkansas, so familiar with the area. Lived in Kansas City for about 10 years doing grad school and then early career stuff up there. And once my husband and I started having a family, it just kind of made more sense to be closer to our family to make it easier on us and have our kids have a relationship with grandparents, and also just wanting to get back to nature, the outdoors, the things we love here, and life is just a lot easier in Northwest Arkansas than it is in a bigger city with commuting and traffic and all that stuff. So I love living up here because it's an easy place to live, and it has fun activities to do, lots of free and easy things. I have young kids, and so getting out and doing things, going on hikes that are quick, like 30-minute drives, or going canoeing or boating. Yeah, it's just a good place. I like that it's a college town. There's a lot of energy that comes with that, and yeah. Mental health has always been something that I've found super fascinating. It's always been very interesting to me, just how powerful the brain can be and how it can change the way we perceive and experience things, whether that's just in day-to-day life or in like mental health diagnoses. So that was kind of my initial interest in it. And then from there, I'm just kind of a researcher at heart, so I love to dig down and find out and explore and look at different options or hypotheses, and so that drew me to the clinical psych field and the connection between physical health, biological health, as some people might call it, and mental health, but they shouldn't be separate, but some people separate it. That connection is so fascinating and powerful to me, and so that was some of my initial draw to it. And then it's kind of changed as I've gone through different stages of my career in mental health or my education in mental health. And now that I'm in private practice, it's a fun job. It's really sometimes just instantly rewarding, and it's powerful. It has an impact for people, and that's something that not everybody can say about their day-to-day job, and I love that about it.